Hello world, my name is Dr Sohom. I'm a consultant forensic psychiatrist and I live and work here in lovely London. I assess and rehabilitate mentally disordered offenders, or what the tabloids might call the criminally insane. I regularly assess defendants in courts, in prisons, and in special secure psychiatric units that are reserved for the most dangerous and risky and violent patients. Although I specialise in criminal psychiatry, I've got expertise of most aspects of mental health. This video podcast series explains a whole range of mental health topics, particularly severe mental illness, and also many of the episodes, though not all, are related to how that kind of intersects with violence. But mostly I'll be sharing with you a bit about life from the perspective of a psychiatrist. So I would like you to make a Psych for Sore Minds your one-stop shop for information about mental illness. So today's video is a bit more, flippant? That doesn't sound right. Light-hearted than my other episodes. It's about Kanye West. I've got my hip-hop apparel on, my woo-wear. If you love the Wu-Tang, you know what I'm about. And I thought I would make this video about Kanye West's mental health. And this is because on one of my other episodes recently, I interviewed a lovely lady called Ariel, the host of Malice podcast. And we briefly talked about Kanye West's mental health, and I am aware that he's got this diagnosis of bipolar affective disorder, but I didn't know that much about it. So I did a bit of reading, a bit of research, and I think I've got a lot to say about this topic. So this episode specifically is about the features of bipolar affective disorder and Kanye West's presentation and whether or not they kind of match up. I was very careful. I did not say that I would diagnose 𝐜𝐸 because it's impossible. Even for the best psychiatrist in the world, which, by the way, I'm not, but I'm the best psychiatrist that you happen to be listening to right now. Impossible for them to diagnose somebody from afar. I don't care what people say. You have to actually see them. You have to pick up on their mental state examination. You have to ask them the right questions. In making this video, I've looked at a couple of other videos on YouTube of people who diagnose him, and I have to say that's rubbish. However, what I can do is I can talk about potential symptoms and see if they broadly fit in with the diagnosis he has. We should also bear in mind that other mental disorders can present in a similar manner, so there is some overlap between a lot of different disorders. For example, off the top of my head, although clearly this episode is scripted, there's borderline personality disorder, which is renowned for having mood swings. Schizophrenia can present with grandiose ideas, as can narcissistic personality disorder. My point is this: you can't diagnose by only examining a few features that you know about. You have to look at every patient or subject holistically. For this episode, I'm going to look at one previous event, which I'm sure you'll know about, which is when Kanye interrupted Taylor Swift. And also, I'm going to look at some of his more recent political statements.
Yo, Taylor, I'm really happy for you. I'm gonna let you finish. But Beyonce had one of the best videos of all time.
So in 2009, at the VMA Awards, Kanye interrupted Taylor Swift during an acceptance speech for Best Female Video. Now, to me, this did appear very grandiose. It appeared impulsive, it was disinhibited, and this could all possibly be signs of mania. I'll explain later on in this episode what mania is, but very briefly, it's a feature of bipolar affective disorder. But to be honest, Kanye's behaviour could have been many other things unrelated to mental illness. It could have been Kanye just being a bit bratish, it could have been him being ignorant, narcissistic, or a jackass. Not my words, President Obama's words.
He's a jackass.
Or, what I thought at the time is it could just him being sort of intoxicated, because it was an award show. Presumably there'll be free drinks, there'll be the party spirit. So what I'm saying is his behaviour did not necessarily reflect mental illness. It's really important to understand that odd or unusual behaviour does not always indicate mental illness. In fact, more people without mental illness do bizarre or inexplicable things every day than people with a diagnosed mental illness. And this needs to be considered not only for celebrities ruining award shows, but also when I give evidence in murder trials. However, the story then changes. Kanye was hospitalized in 2006 for around 9 days, apparently in relation to paranoia and hallucinations. And again, this could be for a whole host of reasons. It could be like an acute stress reaction, which the public might call a breakdown. It could be drug-induced psychosis. It would be unusual for somebody to present with bipolar affective disorder to be treated within such a small space of time. and to get better. However, Kanye did say in 2019 that he was diagnosed a few years earlier with bipolar affective disorder. There are more common symptoms of bipolar affective disorder than paranoia and hallucinations, and I will get into those symptoms in a minute, but it's certainly a feasible presentation. I'd also just like to point out that just because a person, especially a celebrity, says they're diagnosed with mental illness doesn't necessarily make it so. I don't mean to be rude, and I'm not suggesting that people are necessarily intentionally lying, but people often self-diagnose, and I see this very frequently in my line of work for patients to come in who have normal human experiences such as mood swings, and they think that it's mental illness. And I've assessed dozens of patients who've told me they've got bipolar affective disorder, but if you look at their medical notes, actually they don't. And I think that's unfair on those people that actually do have this disorder. It kind of cheapens their experience, in my opinion. I don't actually think that's the case for Kanye West. I think the diagnosis is genuine, and I'll explain why. So looking at his more recent comments, around July 2020, he was at a political campaign event in South Carolina, and his behavior was definitely a bit bizarre.
And God said, if you fuck with my vision, I'm gonna fuck with yours. My mom saved my life. My dad wanted to abort me. There would have been no Kanye West because my dad was too busy.
He was wearing a bulletproof vest, not official woo-wear. He was kind of labile in his mood, he was crying at times, and he made some really bizarre comments, such as, everybody who has a baby should be given $1 million, and that all cannabis should be free. And separate to that particular event, 𝐏𝐸𝐲 has made some other very bizarre statements recently, including that vaccines paralyze children. Now, that's not funny, that's potentially a obviously dangerous statement to make. And what I worry about is that some of his more naive supporters believe this, and they could actually endanger the lives of their own children. Kanye also said that some humans have the devil inside them, and that they plant microchips into other people so those people can't enter heaven. He also said that if he became president, his party would base his vision of what a country should be like around Wakanda from Black Panther. You could maybe at a stretch argue that the ideas about vaccines are not delusional, because some people have similar ideas based off just ignorance. But all that devil microchip stuff, from my experience, this is barn door psychosis. And in my view, all of this is indicative of a period of mania, which leads to a question: what is mania? So bipolar affective disorder is a chronic fluctuation in mood, and it affects about just over 1% of the population. So sufferers have periods of mania, which is an elevated, really high mood, and also periods of depression, and in between they might have periods of euthymia, as in euthymic, which is a normal mood, and my regular listeners will be familiar with this term. Mania typically involves things being speeded up, having a flight of ideas, a decreased need for sleep, lots of energy, increased appetite, speaking quickly like I'm doing right now. And, relevant to Kanye West, it comes with grandiosity, which can include grandiose delusions. So grandiosity is basically being full of yourself. So it's hardly an alien trait for the average rapper. In one of my previous podcast recordings, I speak about the symptoms of mania with Ariel, and she has suffered them, and she described what it actually feels like. One of the problems is that mania is associated with an elevated mood, so feeling happy, feeling euphoric. So one of the issues that some people have is they don't have insight, and they don't want this feeling to stop, because why would you not want to feel happy? But the problem isn't the happiness, but rather the other symptoms, which can be quite damaging. Often people commit some quite impulsive acts, for example, spending money that they don't have or being sexually promiscuous. In terms of consequences, you could kind of think of it like being comparable to being like drunk all the time. So it might feel good, but you would probably make some decisions that you later regret when you're finally lucid. And this is reflected in Ye's behaviour after the Taylor Swift incident, because he was apologetic, he was embarrassed. So another good question is, what is the distinction between hypomania and mania? The answer is basically about functioning. So if you have the same symptoms that I described of mania, but they're a bit softer and you're still able to function, still able to go to work, still able to maintain family life, then by definition, that's hypomania. Which leads us to what I think is one of the most interesting aspects of this case in regards to Kanye West. I think he's unique from other people who suffer with bipolar affective disorder. And that's because I think the distinction between mania and hypomania in his case, if you're a rap superstar, is blurred. I think you could argue that the boundary is warped for Kanye because even with outlandish behavior, bizarre behavior, crazy ideas, he's still able to function in his role more than the average person because that's the nature of his job and because of his celebrity. So to think of it another way, right, imagine he was an accountant and he was making the same statements. He'd probably be taking a little trip to the HR department and he might even be sacked from work because of his behavior, because it's kind of uncontainable, unacceptable. But because Kanye is who he is, some people might mock him, which I don't condone, by the way, if it is due to mental illness, or they might roll their eyes thinking this is just typical outlandish behavior, or dangerously, they might actually agree with him and his bizarre ideas, which I think would just encourage him. So I'm going to answer the ultimate question, which is this: is the behavior and presentation of Kanye West reflective of mania? As I said before, I can only really definitively diagnose mania or bipolar affective disorder by assessing Kanye West in person. So Kanye, if you're looking for a psychiatrist, I'm available. You might have to travel all the way to London. But if I did assess him, I'd have to look at all the other symptoms. I'd have to see if his thoughts were speeded up, see if he had increased energy with decreased sleep. And if he did have all those things, then to me, it's quite obvious that he was suffering from bipolar affective disorder. But if he didn't have those symptoms, then on balance, it's quite likely that his grandiosity was caused by something else, such as the mental disorders that I mentioned before. However, what Kanye West has been saying and doing is definitely in keeping with the thoughts that somebody might have during mania. The other thing I want to say is that if this is bipolar affective disorder or any mental illness, then Kanye West needs help. Although bipolar affective disorder does have fluctuations, generally it's unlikely to resolve without specific treatment. And I know he's mentioned in interviews that he takes medication. So typically for mania, you have mood stabilizers. The ones that you might have heard of are lithium and valproate. And if you're in a period of depression, then you can take antidepressants. But it's actually quite dangerous because if you take too much, then it can flip you into mania. You could end up going the other way. And I've definitely seen many people in my career with this diagnosis who are feeling down, take antidepressants and become manic. So if he is taking medication, I wonder whether he's been compliant of his meds recently or if his bipolar is getting worse and he might need an increased dose. The other thing is that I would say that his illness might have been brought on by stress. I know that 𝐜𝐵's been dropping new albums recently. He's seriously considered a presidential run, which by the way in itself could be thought of as quite grandiose and related to mania. But then again, some other unlikely candidates have tried recently, as we all know, and have succeeded in becoming, in my opinion, the worst presidents in the States in history. So you've heard of the GOAT. I think Donald Trump should be the bloat, biggest laughingstock of all time. #bloat if you agree with me. But to be serious for a second, I think another really important point is that we shouldn't judge or laugh at people with bipolar affective disorder. I think there's something kind of voyeuristic about taking glee in watching Kanye West deteriorate and making these strange statements. And to be fair, maybe it's jealousy, because who wouldn't want the lifestyle of a superstar rapper? I don't think there's anything wrong about talking about it or talking about him. I think in general, if we can talk about mental illness and destigmatize it, then it becomes less of a big deal. And then it might give other people the bravery to talk about their own issues. But I think it's a fine line of people talking about Kanye West or anybody else to learn from them and people talking about them to mock them. Now, I really hope that I'm doing the former, and if you disagree, let me know in the comments below. If anybody listening to this is suffering from any of these symptoms or has friends or family in a similar situation, my advice would be to seek help. Your general practitioner or family doctor is the first line of treatment they can refer on. Unfortunately, in the UK at least, there's usually a waiting list to get non-urgent help, which is very long, several weeks, sometimes months. And I have to say, I think it's getting longer because of coronavirus and restrictions and a reduction in community mental health teams' abilities to carry their workload. I'm sorry to say this, but it's really not a good time to become mentally unwell. I've got lots to say about this, but maybe I should save that for another episode. So my final thought for you guys is this. Sometimes celebrities can have a lack of taste and a lack of boundaries, and they might say some outlandish things, as I know Kanye West has done in the past. And I think if they are psychiatrically well, and if what they say is within their control, although I don't think they should be like mocked or bullied, they should at least be held accountable to their statements, because that is part and parcel of being a celebrity. They intentionally put themselves out there. And there are a lot of sheep around there and a lot of stans who follow them, and it could affect those people's views. However, if it's related to mental illness, and as I've said in Kanye's case, I think on balance it probably is, at least his more recent outburst, then in my view that's different, and it can be quite damaging to the individual and to people with mental illnesses in general if we focus on what they're doing in a nasty or derogatory manner. So I hope this episode has helped people to see his words and the actions of Kanye West in a different light. And I'm also open to suggestions, so if you're listening or if you're watching this and you have any particular ideas, questions, anything that you would like me to dissect from the perspective of a psychiatrist to inform other people, then hit me up, I'm all ears. So I need something from you guys. Please subscribe to our channel on YouTube. Not only does it help me out immeasurably, but it actually reverses global warming. The other thing I wanted to say is I'm going to be a part of CrimeCon 2021. That's the world's biggest crime convention. Lots of guest speakers. I'm going to be talking about 2 particularly gruesome cases. They are real life people that I've assessed who have killed their own family members. One had a severe mental illness which caused it, one didn't. So please look out for that. You're very welcome to come along. Love to meet you there. Follow us on Instagram, like our Facebook page, submit an episode idea or any questions to our email, which is psychforsoreminds@gmail.com. And if you want to reference us, use #PsychSore. Please tell your favourite people about Psych for Sore Minds. Come on, they deserve it. Spread the love. Until next time, stay euthymic, homies.